But I'd like to introduce to you Katie Baxter. She is the Senior Director of Clinical Services, who's going to cover focus area number 7, dealing with the health and wellness for vulnerable populations here in Genesee County. And Katie, the floor is yours.
Good evening, everyone. It's very nice to be here. I'm happy to be here to talk about some of the services that we provide at Genesee Health System and how we could expand some of these services to other populations. The focus area is general health and wellness for vulnerable populations. As Mr. Russell mentioned, we serve very vulnerable individuals. We serve individuals with adults with serious mental illness, children with serious emotional disturbances, as well as adults and children with intellectual and developmental disabilities. We provide a wide array of mental health services for these individuals. Most of them, these individuals do have Medicaid. Just to touch on some of the areas that we provide evidence-based practice therapies, which we call EBPs. And the reason we use evidence-based practice therapies are because these are research-based methods that are able to demonstrate good outcomes for the individuals we serve. We also have medication clinics to provide psychiatric stability for individuals needing psychotropic medication. We provide a variety of community living supports to enhance people's life in the community, having integrated care in the community, and living the lives that they choose. We provide integrated health care through our federally qualified health center, Genesee Community Health Center. And there we have not only physical health or primary care, but we also provide behavioral health care. We have a number of behavioral health care specialists available to assist people with mental health needs as well. And that includes recovery coaches and social workers and psychiatric nurse practitioners for whole mind and body wellness. We also provide case management services. And case management services are allowing individuals to develop a plan for their life, for a happy life for themselves. And that really means not only receiving mental health services that we provide, but linking to a variety of services in the community. And these can be housing, nutrition, insurance, transportation. It could be vocation, healthcare, many others. We also provide outreach services. As Elizabeth mentioned, we have a large outreach team that provides services in the community and connects people who have been impacted, adults and children, by the Flint water crisis. We have peer services, and peers are individuals with lived experience who accompany somebody on their mental health recovery journey. And so these are just a sample of some of the many things we provide for individuals with serious mental illness and intellectual and developmental disabilities. I think it's important to note, as Mr. Russell mentioned, that we are primarily Medicaid funded, and there are certain restrictions and things that we can and cannot do with Medicaid dollars. And that does limit the kinds of services we provide and to whom we provide those services. The millage would be a good opportunity to expand these services to people without Medicaid or other individuals who, what we call, have mild to moderate mental health issues. They may not have a serious mental illness, but they are knocking on our door or calling us and are having mental health needs, and we want to be able to serve them. So the millage would really be an opportunity to expand that. As some of our other speakers have mentioned, we have a variety of grants that we do seek. We do gap analysis and look for services and needs in the community that are not covered by our Medicaid dollars, but still there are gaps that remain. And the millage would be an opportunity to really fill in the gap and be a safety network for Genesee County and the community. So we're very excited for this opportunity for the millage. Thank you so much.
Thank you, Katie. Again, if you have any questions about the millage or GHS, please post it in the Q&A box and one of my colleagues will get to it. We also did a poll with Dental Research earlier this month. The poll was conducted March 5th and March 6th. We had 300 completed responses of likely voters coming up in May. 40% of those folks had cell phones and the rest had landlines, which is very important because a lot of individuals and homeowners are switching to cell phone service versus your traditional landline phone now. So, but we wanted to share some of the key findings with everybody as well. And before we did even any messaging with the poll, we had asked if they would support a millage for mental health support services, and 76% of the respondents said yes, which is very significant given that it's an off-cycle election itself. Once we shared that part of the funding would go to embed somebody with law enforcement that had mental health background and it was a professional, that number jumped up to 81% of the respondents themselves. Third, 84% of the respondents were likely to support the millage after hearing that would create a mental health crisis center in collaboration with Hurley Medical Center. As Jennifer mentioned, this facility is on Fifth Avenue, just west of Grand Traverse Street, and as part of the Hurley Medical Center campus itself. And then finally, overall, we asked everybody after we did all the messaging if they would be supportive, and the number really stayed up at 81% supporting the millage. 10% were opposed, which is understandable, and then 10% were really unsure as to how they would vote. But most importantly, we asked those individuals completing the poll, why would you support or why do you oppose the millage? And these are their actual responses that we received. First, we can't leave people in the community behind. I'd rather see people get the help rather than to go to jail. It would relieve some of the tension on police dealing with folks having personal crises. I have relatives who suffer from mental health challenges. I definitely understand the need for more services in our area. Mental health is just as important as physical health. I totally understand that. I try to do a couple miles every day. I have a son who has mental health issues, so the issue is very close to home to me. There's hardly anything out there to help people who are suicidal, or the state of Michigan should pay for this. What I would like to note is that with those most of those positive comments, we had received 3 pages worth of comments from individuals. So it was very sobering to read through that and share that with you tonight as well. But we wanted to, at least get the voices of Genesee County residents out there for you to consider. One of the biggest questions we always receive is, what is this going to cost me as a taxpayer? So if you're at home this evening, if you want to pull up your tax bill from your local municipality, you want to look for the taxable value of your residential property, and then use this formula to calculate what your yearly tax is going to be. So for instance, if your taxable value is $25,000 a year, the tax per year is $23.50, or just 6 cents a day. If it's the taxable value is $50,000, the tax per year is only $47, or 12 cents a day. Or if you have a home that's at least $200,000 of taxable value, the cost per year is $188, or 51 cents a day. So I'll leave this up on the screen, and perhaps we can pull this into the Q&A as well. So you just copy that formula, look up your taxable value of your property, and then do the math, and that's what the cost would be over the next per year. As we have done these presentations around Genesee County, we have done 19 of them so far, mainly with organizations, meeting with law enforcement and the sheriff's office and the prosecutor and municipalities. We have also garnered this support. So we have public support from State Senator Jim Ananick and State Senator Ken Horn. State Representatives Tim Sneller and John Cherry, 2 county commissioners, Dominique Clemens and Charles Winfrey, Luke Zelli from the Disability Network, Judge Jenny Barkey from the Genesee County Probate Court, Dr. Mona Hana-Atisha, who everybody I think in Genesee County is very aware of. She's very involved in the Flint water crisis and exposing the lead contamination in children in Flint. Support from the Genesee County Superintendent Association, the Greater Flint Health Coalition, and the Genesee County Prevention Coalition. So we expect to do many more presentations the rest of this month and into April. So if you would like us to come and present to an organization that you're a part of, please put your contact information in the chat box, and we will be following up to make those arrangements. And so that is our town hall for this evening. You can find more information about the millage itself at www.geneseethefuture.org. We thank you for attending this evening. We hope to do one more town hall next month for everybody. We will be doing some direct mail to voters. You'll see some billboards and advertisement on the MTA system pop up over the next couple of weeks as we try to get the word out about the importance of this millage for our county. So thank you for attending this evening. We will stay on the line till say 6:40. If there's any further questions that anybody may have, please pop them into the Q&A and my colleagues and I will answer those to the best of our ability. So thank you for coming tonight.